Unexplained infertility. It is the term many times many infertility specialists they use when the cause of infertility is not known. What is unexplained infertility? What are the possible causes of unexplained infertility? What can we do in an unexplained infertility? Should IUI be done? How many times IUI be done? Or IVF is test tube baby an answer for the unexplained infertility? We will discuss this topic of unexplained infertility in today's video. Hello, good morning, good afternoon, wherever you are. I am Dr. Rajat and you are watching our YouTube channel. Today we are going to discuss about a very famous topic, unexplained infertility, and we would try to explain what is unexplained infertility. So first of all, what is unexplained infertility? Fertility, as you all know, is basically because of two things. One is male, one is female cause. There can be various causes in females, the fallopian tubes, the eggs, the uterus, and in males there can be the sperm causes. So if the semen analysis is normal, the fallopian tube is normal, and uterus is normal on an ultrasound, and she is ovulating normally, female is ovulating normally, there is no anovulation, there is no decrease in ovarian reserve. That is when we call as an unexplained infertility. They say that 30 to 40% cases of unexplained infertility are because of female causes, 30 to 40% are because of male causes, and in about 20% it is about mixed causes. But we as doctors do not know the causes in about 50 to 70% of the cases, and that is when we label them as unexplained infertility. So, like I said, this is the uterus, this is fallopian tubes, and these are ovaries, and this is the vagina. Whenever the couple have intercourse, the semen gets deposited here. From this semen, the sperm travels up here at this place. The female ovulates in every cycle from this place. The egg then is picked up by the fallopian tube, the fimbrial end, and it goes inside. The fertilization occurs here, and that fertilized embryo then travels to the uterus and then gets implanted here, and that is how the fertility occurs. So if there is, we know the possible causes, the couple are having regular intercourse, the semen gets deposited here, there is no male factor like impotence or retrograde ejaculation or inejaculation, and the semen is coming up, the female is ovulating normally, the fallopian tubes are normal, the uterus is apparently normal, there is no adenomyosis, there is no fibroid, there is no polyp. That is when we call as an unexplained infertility. So the question arises, how common is unexplained infertility? We have been practicing infertility for almost 20 years now, and to be very frank, about 50% to 70% cases are apparently normal. There is no apparent cause in females, there is no apparent cause in males, and they are of unexplained infertility. Many couples come to me and ask, sir, is it possible to conceive? What problem do I have? That is when I tell them that apparently you do not have any problem and it is perfectly possible for you to conceive. Many studies have been there. They say if for an unexplained infertility, the couple keeps on trying for 2.5, 3 years, then almost 80 to 90% of the couples conceive. The problem with those patients is that they do not have the patience. They just do keep on doctor shopping. They go to a doctor for 2, 3, 4 months, expect miracles from that person, again shift the doctor. The key is to believe in a doctor. Give him or her some time, try for at least 9 to 12 months. Now why I say try for 9 to 12 months, because per month conception chances, if everything is normal, the husband semen analysis is normal, ovulation is normal, hormonal reports are normal, and fallopian tubes are patent, then the chances of pregnancy per month are about 4 to 7%, and the cumulative chances of pregnancy in 1 year is about 80%, in 2 years is about 90%, and in 3 years is about 95%. So that comes to our next question. What are the possible causes of unexplained infertility? In most of the cases, according to me, the hormones and the lifestyle and the dietary choices the couple makes, they are the causes of unexplained infertility. Let me explain how. AMH, anti-Mullerian hormone, is a test which not many gynecologists do. We do it regularly in almost all our patients. By the time the hormonal disturbances start occurring, the decrease in AMH occurs way before that. So the moment we find that there is a decrease in AMH, we can predict that after a few years the hormonal disturbances would start occurring, and those hormonal disturbances would be in the form of FSH, LH, and followed by estrogen and progesterone. So the decrease in ovarian reserve, which starts with an AMH, and by the way, the AMH, which earlier used to be normal of about 2.18, and about 10-15 years back we used to say after 30, after 31, 35 the female eggs start decreasing. Nowadays what we have started seeing at the age of 27, 28 the female's eggs start decreasing. So we have to act early. Every female in an infertility evaluation should get an AMH done. Primarily because we know that whether the if AMH is more, we can know that this is a case of a polycystic ovarian syndrome, or if AMH is low, we can know she's at the other spectrum of a decreased ovarian reserve, and see it guides us the speed of treatment. Second point, like I said, that if there is a decreased ovarian reserve, the cycles would start get shortening, the ovulation would occur early, there would be some kind of a luteal phase defect. Second point, which not many people get it done in a case of a polycystic ovarian disease. First of all, not many people can know what is PCOD. It is basically an enigma. Every obese female is not a PCOD. Every ultrasound appearance of ovary which is suggestive of PCO is not a PCOD. So there are various kinds and criteria of PCOD. The most common is PCOD with insulin resistance. So the test of an insulin resistance has to be got done in each and every female, especially if she is obese, especially if she is lean PCO, especially if there are signs of androgen excess like hirsutism or acne or hair fall or pattern of male pattern blindness. So AMH is one of the causes of unexplained infertility. Insulin resistance is one of the causes of unexplained infertility. We also get few tests done like thyroid antibody test, even if TSH is normal. And by the way, many people think TSH of more than 5 is abnormal. There is an entity called as in subclinical hypothyroidism, in which the TSH is between 2.5 to 5, and there are many groups of doctors who believe that hypothyroidism should be treated only when TSH is more than 5. We are among the group of doctors in which subclinical hypothyroidism should also be treated, and then gives us good results. Especially with subclinical hypothyroidism, if there is a presence of thyroid antibodies, and those antibodies are especially helpful if there have been cases of previous IVF failures or there have been cases of previous miscarriages. Also, stress. Everybody says stress, but nobody knows what is stress. Stress cannot be seen, stress cannot be experienced, stress cannot be measured, and stress cannot be treated. It only has to be managed. What does stress do? See, I mean, from a teleological point of view, God made two hormones, adrenaline and cortisol, and there are two systems in our body, sympathetic system and parasympathetic system. Usually, sympathetic system and parasympathetic system, they all always in balance. Whenever there is a kind of a situation of a stress, that means a life-threatening condition or a dangerous condition, like if I'm crossing on road, I see a tiger or I see a snake, or suddenly there is a fast bus or a train coming to me and I am kind of fear. So the first reaction I would have in my body is of fear and fright and flight. So the moment I am in fear, the stress response in my body would go up, and it will increase the secretion of cortisol and adrenaline. And second reaction would be flight. So I would run away. So that, what does this cortisol and adrenaline do? They basically, adrenaline, what it does is basically constrict. So what does this adrenaline and cortisol basically do? Adrenaline basically constricts every blood vessels of the body during stress, and that is why whenever we are in points of any stress or any fearful or a frightful condition, there is a whitening or a pallor of our peripheries. We feel like the peripheries have become cold, and there is raising of hairs. These are piloerection, that is what we call. These are the stress responses. And as a result of the vasoconstriction, the blood supply is maintained only in the essential organs of the body, that is heart, brain and kidney. And uterus, ovaries, for all possible reasons, they are not essential for living, and that is why the blood flow is diverted from them. This is an acute response of stress. But nowadays, in our daily lives, modern life, stress has become a part of daily life. The deadlines, the schedules, the jobs, the pressures, everything is creating the stress. So what that is doing is reducing the blood flow to the uterus, ovaries, and that is why we are living in a stage of chronic stress. So we have to manage that stress. We'll come to it, how to manage the stress. And one another possible cause of stress is this, yes, I'm right, this smartphone. What does this smartphone do? Or for that matter, any device which is emitting the blue light. Our bodies have been programmed to work according to the sun, that is the hormones are secreted according to the sun. It is a circadian rhythm. So the moment there is a sunrise, the hormones are at their peak at time of sunrise between 6 to 8 a.m. And that is why most of the test of the hormones we normally do at sunrise. And by the time of sunset, those hormones decrease. So there is a gland here beneath the hypothalamus that is called as a pineal gland. It reacts to the way light is secreting. And that pineal gland is stimulated by melatonin. It reacts to all the lights. The moment there is any kind of a blue light from mobiles, from screen, from televisions, from gadgets, then this pineal gland thinks that there is a day. It is not night, and that is why the hormone disturbances start occurring. So we have to stop using excessive use of this mobile. It creates the hormonal disturbances, the melatonin disturbances. So people say, if it is an unexplained infertility, when can I conceive? See, my logic is very simple. First of all, we as doctors do not do miracles. We just try and bring the physiology of the patient to as near as possible as God has created, and then let the nature work its magic. Why don't people conceive in every cycle? God has made a natural contraceptive mechanism so that if people start conceiving in every cycle, then the population would be in multiples of billions, which we do not want. So people have to be patient. This is an easier said than done. Truth be told, many people we lose because when we tell them, please give us 9 months to 12 months, and people are not willing to wait. This is an age of Maggie. Everybody wants quick results. Everybody wants the fast foods. With fast food, the diet which we are consuming is one of the very important factors which is leading us to infertility. All these fast foods which contains glutens, the wheat which we are eating, which is genetically modified food, it contains gluten. They are creating some kind of an inflammation in our body, and this inflammation leads to various pathological changes, and it is cause of 15% cases of unexplained infertility is because of gluten. It is a huge entity for the people who believe in. Gluten cannot be diagnosed by a routine test. There are various diagnostic tests. We do transglutaminase, eliminase antibodies, we do an endoscopic biopsy of the stomach, and then we know what the gluten is. But the answer to the gluten intolerance lies in avoiding gluten totally. We'll do a separate video on gluten sometime later on, but then yes, it is. The excessive use of sugar. Human beings are not meant to eat sugar. Sugar is something which leads to a rise in insulin in our body. The more sugar or anything sweet, jaggery or honey we eat leads to increase in insulin in our body. Over a long time, the use of sugar, it leads to inflammation. More insulin means more weight gain, more hormonal disturbances, and over a period of time, it leads to infertility. Is one of the causes. Infertility is one of the end results of eating excessive sugar. People ask me, is unexplained infertility genetic? My parents had it. Would I also have it, or would my kids also have it? See, I personally believe while the genetic causes might be one of the reasons for unexplained, which is a very tiny, but these genetics are always influenced by lifestyle and diet. This is called as epigenetics. So if your lives, you cannot modify your genetics, you cannot modify the place where you are born, the parents who you are born to, but what you can definitely modify is the way you live, the way you have your physical activity, the what you eat, how you eat, when you eat, how much you exercise, how much you walk, how much you run. All these kind of things, they definitely make a difference. Does any kind of infection lead to infertility? The answer can be both yes and no. While there is no obvious infection which can lead to infertility, most of the infections, what they do is they lead to some kind of an inflammation in our body. And if you go into the details, almost every disease has its origin in inflammation. COVID had it, cancer has it, diabetes has it, blood pressure has it, and all these inflammations are in some way related to some kind of cytokines imbalance in the body, which ultimately lead to, at a microscopic, at a molecular level, at a cellular level, to the infertility. So, how do I approach a case of a unexplained infertility? A patient has come to me, he has visited various doctors, the doctors say everything is fine, egg is forming well, follicular monitoring is done, ovulation occurs fantastic, HSG is fine, laparoscopy is fine, husband semen analysis is good. So in those cases, like I said, I'll do an AMH, I'll do an insulin resistance test, I'll look at the lifestyle, I'll look at the BMI of the patients, I'll tell them the ways of stress management, I'll tell them the ways of lifestyle, dietary management, which we have, and then what we will do is, I firmly believe that there is something called as a mitochondrial rejuvenation. In class 4, class 5, we read something called as mitochondria. Mitochondria is basically a part of cell which produces energy, and those cells which have got good mitochondria, they are good quality cells. Same applies for sperm, same applies for eggs. I want mitochondria to be in good health, and as we age, the mitochondria, the quality and the number decreases. We need to rejuvenate mitochondria. What can be done to rejuvenate mitochondria? Good amount of exercise, walking, running, swimming, jogging, weights, gym, floor exercise. Fasting is a very good way to rejuvenate mitochondria. Either it can be a form of an intermittent fasting, or it can be a form of regular fasting. Some kind of caloric restriction is always good, and plus supplements, any kind of antioxidants. It can be from diet. The good antioxidants are the ones which are there in red, yellow, orange and green foods. Red means tomato, beetroot. Orange means papaya. Orange means carrot. It can be also in form of lemon. It can be in form of sweet lime. Any bright green fruits, all kinds of green leafy vegetables. Excuse me. These are very good form of antioxidants. They contain lycopene, they contain vitamin A, they contain vitamin C, and of course a good dash of dry fruits. But that doesn't mean you eat handful of dry fruits, just few 8 to 10 dry fruits and out of them the walnut and the almond is a very good source of vitamin E and omega-3 fatty acids, plus supplements which contain all these kind of things, L-carnitine, coenzyme Q. All these antioxidants are good mitochondrial rejuvenators. They are also called as bioenergizers. So I have counseled my patient for dietary modification, lifestyle modification, some kind of meditation, yoga, deep breathing exercise for stress reduction. By the way, early morning walking is the best and simplest way to decrease the stress. Early morning walking, especially of 45 to 50 minutes, what it does is it produces endorphins and dopamines. Those are happy hormones. It rejuvenates you, it provokes you to think more, it decreases the amount of stress, it reduces the amount of inflammation over a period of time, it reduces your body weight, and that is a very good exercise to start with for the infertility patients. I always tell my patients, we as human beings, we have been programmed to walk for 20 kilometers a day. Unfortunately, we all have stopped walking. We do not walk. For every damn bloody thing, we either take a two-wheeler, four-wheeler. We should walk. Instead of spending thousands of rupees on a new pair of dress or a new pair of smartphone or a new pair of Googles, it is better we invest on a good quality shoes. We walk. Going to gym is a fad. Yes, you should go to gym, but please walk. The irony of the matter is you go to gym to walk on a treadmill, on a two-wheeler or a four-wheeler. If you really want to exercise, please walk and go to gym. I do not understand why the people are not walking nowadays. Everybody should walk 8 to 10 kilometers a day, not at the same time. It can be divided 4 times a day, 5 times a day. For any small bloody damn things, please walk. Walk and take groceries, the fruits, the vegetables, picking and dropping your kid at your school for minor course. Please walk. Walking is the best exercise. Many housewives, many women who are not walking, they tell me, sir, we work at our home. This is a huge exercise. Yes, that is a part, but walking itself is a better exercise. So many people call me and say, sir, why not do an IUI for unexplained infertility? Does IUI help in unexplained infertility? Answer is yes. But how do you do IUI? Whether that IUI is an optimized thing or not, whether it has been done under optimized condition or not. First of all, you have to understand what is IUI. IUI is called as an intrauterine insemination. Normally, when the couples have relation at this place, the semen gets deposited here, and from here the sperms travel here. In IUI, what we do is we take the semen of the husband, we put it into a centrifuge machine, separate the seminal fluid from the sperms, take the good quality sperms, take it into the syringe, and directly deposit the semen at this place. Does IUI increase the chances of pregnancy? Yes, but if the chances of normal pregnancy per month in a cycle is about 4 to 7%, the IUI would only increase the chances of pregnancy by 2% because it would avoid this cervical barrier. Rest all the factors which occur in a normal pregnancy, normal cycle, they remain the same. While doing an IUI, if we are doing a stimulated IUI, we give gonadotropin injections to the patient so that the more eggs are formed, the chances of pregnancy in a cycle with an IUI increase. So that comes to my next question, what are the chances of pregnancy in an IUI? If there is a single formation of egg, one egg is formed, then the chances of IUI per cycle are about 9 to 11%. If 2 eggs are formed, then the chances are about 11 to 14%. And if 3 eggs are formed, then the chances are about 14 to 17%. So does that mean that if there are 4 or 5 eggs in an IUI cycle, then the chances of pregnancy would increase more than 17%? The answer is no, because the human body does not work in that way. So our target as an fertility doctor is to make sure that either the number of eggs is 1, 2 or maximum 3, and then we do in IUI. But IUI is not a magic bullet, is not a Ramban that will increase the chances of pregnancy. The problem with IUI is the moment I tell that we do something significant, then the expectations of patients increase. And the moment that expectation increase, there is a massive fluctuation in the hormone levels, especially FSH, LH of the female. And that is why the chances are decreasing. So if the female is neutral, doesn't have much expectation, then the chances increase. So that is why I tell my patients that you have to make your brain believe that you are not doing any kind of treatment, you are just coming, you are not doing treatment. Because what we have found is, in many cases, people get frustrated, they either burn their files, they tear away their files, throw their files, and sometimes they go to a vacation, or they stop their treatment, or sometimes they adopt another child and they conceive on their own. What it tells me, that if you are mentally neutral, there is no level of stress in your body, then the chances of conception, they increase. How many times an IUI should be done? They say that if IUI has to succeed, you can do 3 times, maximum 4 times. IUI should not be done more than 4 times in an under optimal conditions. If the results with IUI have to be got, then they'll be gotten within 4 to 6 cycles. But we at our place do only 4 cycles because it is a costly affair. The IUI costs about 10 to 15,000 per cycle. I believe that you should give a maximum of 3 cycles IUI. If there is a donor insemination IUI, then we can try for 6 cycles. Otherwise, there is no point of trying IUI more than 4 cycles. What if the IUI fails? What if we do not get the results in 4 cycles or 3 cycles of an IUI? What is the next? Say if there is a good AMH and the patients are affording, then the next logical step would be an IVF, test tube baby. But if the patients are not affording, then I would say that they can wait. They can try on their own. They'll still conceive within maybe a year or 2. Most of them, they do conceive. But what mistake most of the patients, they do when they try at home? They do not take any medicines. I'm not here to sell my medicines or somebody else's medicines. But if the patients are taking the medicines of folic acid, vitamin B12, or whatever hormonal disturbances they are having, if there is an insulin resistance, they are taking metformin, myoinositol. If there is a hyperprolactinemia, they are taking cabergoline, or if there is any kind of a decreased ovarian reserve, they are taking DHEA. Then if and when they do conceive, which they'll eventually do, most of them they'll eventually do, the chances that the quality of egg would be better, and for that matter, because of that better quality, the pregnancy would be better, would be much higher. Unfortunately, most of the patients, once they have stopped treatment, they stop taking medicines and they come to us after 6 months, 1 year, 2 years with pregnancy. And 40 to 50% of the chances of cases of those pregnancy, they end up in miscarriage. They do not understand that the tablets, folic acid, vitamin B12, all those medicines have to be taken at least 3 months before you conceive. But because you do not know when you conceive, it is better to be continuously on medicines, so that by the time you conceive, the quality of eggs is good. And also, whenever you are trying at home, the dietary and the lifestyle modifications which you try, they should be done continuously. The moment you stop treatment at your hospital, it is not that you stop taking care of diet and all those kind of things. Age, does it have an effect on an unexplained infertility? It is in fact the most common cause of unexplained infertility. People say, सर हमने वो बधाई हो देखी थी, उसमें वो 50-52 साल की फीमेल को प्रेगनेंसी रुक गई, 40-45 साल के फीमेल्स को प्रेगनेंसी रुक गई. Yes, but the answer is they do not want the pregnancy. The moment there is a difference between a want and not wanting a pregnancy. Like I said, the moment you want a pregnancy, your mind is an overdrive. It thinks, why am I not getting pregnant? Why everybody else is getting pregnant? The moment you are in that kind of a stress, I personally give an analogy of the moment the female who desperately wants pregnancy, she is like in a black room in which there is no source of light, and she doesn't know when there will be a source of light or there would be sunlight. So that creates the wanting, the desperation to get a pregnancy, that creates a pressure, that is a external pressure by the in-laws, friends, peers, families, and the internal pressure that the female is taking on herself. Why I am not getting pregnant? Why I am not becoming a mother? That creates the levels of hormonal disturbances. But the moment that desperation is gone, either through the loss of hope, now I am not going to get pregnant, or now there is no chance that I will become pregnant, then the hormones level sometimes subside, and like they say, the miracles do happen, and they conceive when they least expect it, when they least want it. So we want to create, in our infertility treatment, we want to create that kind of zone in the females when they are not hoping, not wanting, not expecting pregnancy in their cycle. It is easier said than done, but the moment you occupy your mind with other kind of things to work upon. So that is why I say idle mind is a devil's workshop. So you do not have to keep on thinking every time, why I am not getting pregnant, why I am not getting pregnant. I advise my females patients who are not getting pregnant, especially who are not working professionally, to go and do some kind of a professional job. Either it may not be for money always, but the moment you are doing some kind of a professional 9 to 5 kind of job, you are having a responsibility. You have to do the deadlines. Yes, that will create some kind of stress, but that stress would be manageable. Okay, so you are not thinking of the pregnancy all the time. You are thinking about your job, and let pregnancy come to you automatically. See, this is a process. You have to enter the process. You have to believe in the doctor. You have to have trust in your doctor. And I always tell everybody I meet, there was a very famous statement made by MS Dhoni and Gary Custon before 2011 World Cup, because I'm a big cricket buff. You should believe in process, and result will take care of itself. Like Gita also says, कर्म करते जाओ, फल का ध्यान मत रखो. The moment you are doing your work without wanting or without hoping for results, the results would automatically come. Hope you like this video. Request to kindly subscribe to the channel, and we would bring such kind of fertility and gynec videos regularly in the future also. Thank you. Bye bye.